good evening to all and welcome to this live session with me, Dr. Josephine. And the topic of today's discussion is preventive measures to be taken after the lockdown has ended. So as we all know, the lockdown in India will mostly be ending on the 31st of this month. And all the stores and the public transportations will be operating soon. The flights and the trains have already been started. So this live session is regarding how can you protect yourself amidst the pandemic which is affecting us. And joining with me today is one of my absolute favorite doctor, a pediatric consultant with over 35 years of experience. And currently she's practicing in Australia. Also my mom, Dr. Kirtimalani, who is live from Australia. So without any further ado, let's start today's talk. The questions which some of you have asked will be answered at the end of our talk. And if any new questions, like I've already got some, we will be answering to them as well. So moving on to the first point, my mom will be giving a short talk regarding the COVID-19 situation, which is currently happening in India, and how well we are coping with it. So, Mom, over to you.
Okay, good evening, everybody. I'm sorry, it's because of some technical issues. We are coming late. Anyway, just a brief information about this COVID-19. As you all know, COVID-19 is coronavirus disease 2019. It was first identified in December 2019 in Wuhan, city of China, and has since then spread globally, resulting in an ongoing pandemic. And as of yesterday night, 27th of May, the total cases were 5.61 million all over the 188 countries and territories, and resulting in more than 3.5 lakh deaths. And if you see, the recovered people are more than the deaths. 2.3 million people have been already recovered. As you all know, the spread is through the droplet, and they don't go through the air, they fall on the surface. And if somebody touches the surface and touch to their nose and face, they get the infection. The most contagious period is during the first 3 days after the onset of symptoms. And the common symptoms, as you all know, are cough, sore throat, fever. Fever is usually mild to moderate fever, fatigue, loss of smell sensation, nausea, vomiting, diarrhea, and the prognosis is bad in the people with the chronic comorbidities. Okay, so in India, the situation is worse in some of the big cities where there is more crowding and all. So we are in a way coping well, but the thing is that we don't know how many are really positive, because the rate of testing is much less in India. So we don't know how many exactly the number of people who are affected. But with the lockdown strategies and all, there is still some success in controlling the spread of the disease there.
Yeah, some of my friends have expressed their concern regarding the protective measures to be followed after the lockdown has ended. And many of the people have also lost their jobs due to this corona pandemic, not only in India, but throughout the world. And this has affected their mental health especially. So can you suggest some things to cope up with this mental health issues?
Yes, lockdown was initiated to control the spread of the infection. As you all know, it had some advantages. As you all know, that everyone has got some time to spend with the family, and it brought the family together. And also, some people they found their forgotten hobby rejuvenated. Some people found some new talents in them, and some people found some good, useful things they were already like having in them, but they were not doing. But in this time, they could do that, and they were useful to the society. But not all of the people were that fortunate. Some people lost their jobs, some people lost their earning, and also it has got some financial effects on the country's economy also. So
Very true.
those
Yes.
people, yes. So those people who got this kind of effects, and also some
Mhm.
of the people, they were living lonely. Some people were
Mhm.
isolated. So in that case also, people were like they were very prone to the mental health issues. Many people have developed the mental health issues. Issues like anxiety, depression, post-traumatic
Mhm.
stress disorder, especially the families who lost their loved ones, the family
Mhm.
also who suffered with this infection. The person who suffered and recovered also has the flashback memories and suffering from the post-traumatic stress disorder.
Stress disorder.
The people with
Exactly.
depression, also there is a more possibility of committing suicide, as you have already seen the news of some of the TV serial actresses committed suicide and all. Those kind of news are coming already. So it's very, very important to know how to cope with this strategy, this post lockdown mental health issues. So, like, if somebody is feeling anxious, if somebody is feeling depressed, so you consider that it is normal. It is not
Mhm.
abnormal to have this feeling. It is normal to have this feeling, and you have
Okay.
to talk to someone. Okay, if you
Mhm.
are anxious about this pandemic, try to get the information from the reputable source, like WHO or the communicable disease department of like
Mhm.
America, like CDC. Okay, or you should limit your access to the media. Sometimes
Mhm.
media gives you a negative picture, okay, and it makes you emotionally overwhelmed. So limit your access
Mhm.
to media. You should
True.
focus on what you can control. Don't focus what
Mhm.
you cannot control. What you can do, you
True.
can practice hygiene. You can have the safe practices like putting your mask and washing your hands, keeping good hygiene, cleanliness. All these
True.
things are in your control, so you can do that. Okay,
True.
and it is like give your thought. Like if your thoughts are running like negative, check those thoughts, distract yourself by doing something else, and
Mhm.
anxiety always takes you in the future, what if, but you try to remain in the present, what you are at present. If you are not
Mhm.
infected, be thankful, be grateful that you are still okay, and if you are
Mhm.
infected, you don't have symptoms, be thankful also. So don't go in the future, be in the present, and seek support. If you need any support, seek the support, ask someone, talk to someone, and keep in like stay connected with your friends and families. That's very important. Make video calls
Exactly.
quite often, and
Mhm.
talk to your families, and that also is very important. And most important is look after yourself very well. Okay, take
True.
care of your health, take care of your diet, you know do the
Mhm.
breathing exercises. You should become creative. Try to find some
Mhm.
hobby and pursue that
True.
hobby. Stay creative,
Mhm.
use your imagination, and engage in
True.
your smart brain. Okay, smart brain is a
Mhm.
part of the brain which, if
Mhm.
you have the negative thinking, it becomes inactive. So you have to remove the negative thinking and start using your
Mhm.
smart brain. So there are
True.
also some kind of exercises which are called as mindfulness
Mhm.
exercises. Okay, so
Mhm.
this is a very good coping strategy for the mental health issue. So what is mindfulness exercises? So Mindfulness exercises is it's a type of meditation actually. It's a type of meditation in which you should be aware of your senses. How many senses we have? We have touch, we have smell, we have taste, we have hearing, and we have
Hearing.
eyesight. Okay, so try to use all your senses. How?
Mhm.
Think of three things you can taste. Think of three things you can smell. Think of three things of touch, like what is soft, what is, and try to uh, engross in that. Okay, if you are eating a
Mhm.
food, chew it very slowly and savor the taste of the food. Okay, this is a kind of meditation. And what are the
Mhm.
benefits of this meditation? It will relieve you from stress, anxiety, pain,
Mhm.
depression, insomnia, and also high blood pressure. Okay, if somebody is having high blood pressure, they can get benefit from these exercises. So what are the examples? Again, I will tell you, like you pay attention to your senses. Okay, the sense of smell, like smell. Go in the nature, try to smell the, the flowers, like fragrance. There is some nice fragrance in the nature. So you go there and you can find that. Okay, you can also, as I told you already, the favorite food, you should taste it. Try to live in the moment. Try to intentionally bring open, accepting, and discerning attention in everything that you are doing. Like if you are doing something like knitting, so concentrate in that. Savor that moment, what you are doing exactly. If you are painting, relish that moment of painting. That is living in the moment. Then accept yourself. Accept however you are. Don't expect too much. Don't be hard on yourself, and treat the way you treat your good friend. Treat yourself the way you treat your good friend. That means you be a good friend of yourself. Okay, and focus on your breathing. Try to inhale and try to exhale very cautiously, you sit down and take deep breathing, like pranayam. So deep
Mhm.
breathing exercises are very good. Then there are some other exercises in this, that is body scan meditation. That means you have to think of each part of your body and how you feel about it. That is body scan meditation. Just lie down, close your eyes, and start thinking from head to toe or toe to head. Okay, and each part you should think of, and you should think how grateful you are you have this part of your body. Then you can sit comfortably and you can meditate. Another one way of meditation is you can walk and meditate yourself. Okay, so these are the few things that will help you to cope with your anxiety and depression problem. And then if you need, you have the expert help. You can call your friend, you can call some psychologist and all, so that you can do to cope. Regarding the preventive measures, you first of all, we have to accept that this coronavirus is not going to go away very quickly.
Yeah,
At least
that is exactly.
24 months, 18 to 24 months, you
Mhm.
take it granted that this will be there. There will be short, small waves of the infection, but they will be milder infection. So don't worry
Mhm.
about it. Just keep your routine how you are keeping now. Take the
Mhm.
preventive measure how you are doing now. What are those?
Mhm.
You wash your hands. You whenever you are touching any surface, after after that you should wash your hands. Okay. If you are going out, put a face mask. There is nothing very special about the mask. It is better that you put a face mask. You prevent yourself, and if the other person is also having the face mask, that you have the double prevention. double protection. And also the social distancing, which very, very important. Even if you are traveling by the public transport, try to keep the social distancing. Okay. And still we have to be careful about the social gatherings. Okay. So even if you are coming together with your friends, always keep the social distancing. And as much as possible, we need to avoid consumption of alcohol and all, which will lose your control over the social distancing aspect of the prevention. So these are few of the preventive strategies. If anyone needs to know more, they can ask me. But these are basically the basic preventive strategies.
So the most important thing which we have learned is that not to follow fake news, because even I have seen so many forwards on WhatsApp which says like do this, you won't get affected, do that. But there is a basic guideline which is provided by the WHO, which is very accurate, which is very basic, which we all can follow, using a mask, using a sanitizer, keeping social distancing, avoiding all the gatherings and everything. So these are the basic things which you need to follow. And of course, even your hobbies are very important, to indulge your mind and not to just keep it vacant, because we all know that since now we not everyone can go for jobs. Some people are working from home, but that's not the fact with everyone. Even the schools are closed, everything, colleges are closed. So it's very important, as my mom said, to indulge yourself with something. Most of us have hobbies which we ourselves don't know, but if we even try something like I know some of my friends who have gotten so deep into painting, and they are creating some really good masterpieces now. Me, I got myself indulged into cooking. So that is a very good point which was said. Yes, please indulge yourself. And if any sign of depression or something, you feel yourself low into some part, like no, I'm not able to cope up, call a friend, have a video chat, uh, play with children, children at your home, or maybe even pets. Even that will relax your mind. So the next point is, Mom, what foods or dietary modifications would you like to suggest for an immunity boost up, and also foods that we can avoid? Like, so the basic thing is to increase our immunity. Like, what should we take and what should we avoid just to build up our immunity?
Yeah. So the food should be the fresh food. Try to avoid the stale food. And there are some immunity boosting foods which I would like to mention. First of all, turmeric. It's very good. It's an antiseptic. If in the morning, if you drink a glass of hot water with a pinch of turmeric and lemon, it will kill the whatever viruses are there, you know, and also other organisms in your throat. Okay, and it also subsides the inflammation. There is a substance in turmeric which is called as curcumin, which is very, very important and very useful in subsiding the inflammation wherever it is present in our body. So turmeric is one of the very, very good immune boosting food. Then in fruits, fresh fruits are always good. Papaya is one of such fruits which is very rich in vitamin K, vitamin B, and folate, which are useful in fighting the infection. Then garlic, make more use of garlic. Garlic also gives you a lot of calcium. Then it is rich in B1, B6, and it helps in preventing the gangrene in the necrose tissue. I mean, when people having some kind of chronic morbidities and all, garlic helps to prevent the inflammation. It helps in controlling the blood pressure, also cholesterol levels. And then, if you just take more like garlic raw, I know it is the smell is bad, but usually 5 to 6 cloves in a day gives you good amount of immunity. Then the another thing is green tea. Green tea is rich in flavonoid, and flavonoid they give you good amount of antioxidant. So at least yes, at least 1 to 2 cups of green tea a day is very good in boosting your immunity. Then ginger. Ginger is very good antiseptic and anti-inflammatory. It also curbs the nausea, vomiting feeling. It also helps you to overcome your chronic pain, and it reduces the cholesterol. Then in leafy vegetable, spinach is one very rich source of iron, vitamin C, vitamin A. As you all know, vitamin C is good in giving the immunity because it releases the like antioxidant, and it controls the free radicals. Free radicals of oxygens are created during the inflammation. How the inflammation comes, maybe through infection. Okay, so uh, vitamin C is very helpful in giving you the antioxidant radicals. So spinach is such good source of vitamin C. Then citrus fruits, as you know all, like lemon and oranges and all, that you all are aware of that. Then red bell pepper. Red bell pepper is very good in the it has a very good source of vitamin C, also beta carotene. Okay, beta carotene helps in your skin and your hair health. Then apples are good. They have the pectin, and pectin health is a very good prebiotic. Some people are presented with diarrhea, and the apple is very good in case of diarrhea, like cooked apple. It's like a medicine for diarrhea. Then you have, I told you about turmeric. Then nuts. In nuts, almonds are good. They are rich source of vitamin C, iron, and phosphates. Then you can take sweet potatoes also. They are good source of fiber, and they are good source of complex starch. So like it helps in increasing your metabolic rate, and once your metabolic rate is increased, your inflammation also gets help from that. So these are some of the foods you can take during this time.
So yeah, that was very informative, and many of my friends and colleagues have had asked about this, especially about the dietary modifications and foods which are to be taken. So I hope this helps you all, and this has answered your question, guys. So the basic thing is stick to local foods and stick to what is fresh and cooked at your home rather than all the processed foods and all the things which are cooked at a very high temperature in deep frying, and also these are to be avoided. Even some of my friends who have PCOD, they keep on asking me, what should we do to change our lose our weight and get rid of PCOD. The basic thing is please stick to local and buy local, and stick to fresh foods. Home cooked meals are always way much better rather than any hotel cooked meals or anything for that matter. So this was very informative for us with choosing the right kinds of foods and sticking to our local Indian produce, garlic, ginger, turmeric. These are like ancient herbs from centuries. These have been applied, and in our homes we cook it. Just the thing is, because of the today's modern lifestyle, we don't really stick to these basic things, but that is it. So coming to our next point, Mom, as you are a pediatrician, please can you suggest our viewers regarding the safety measures to be followed to protect their children, or in that case, any child at home or in their surroundings?
Okay. Fortunately, this COVID-19 is not like very common in the children. Those children who get the infection have mild symptoms. Only few have the moderate symptoms, and some of the death happened. Those children were having some other comorbidities like cancers and all. So, but we still have to protect them. Children are always very curious. They are curious, they want to touch the surfaces, but we have to make them not to touch the surfaces without getting panicky, you know. It's okay. They are curious. They want to touch the surface, but you can teach them to have the hand hygiene. So make them a habit of hand washing. Okay, ask them what kind of soap they like. You know, so that they get interested in hand washing. You can teach them the 20-second hand washing. I have seen so many children now showing the 20-second hand washing. So they are very quick to learn. So we can just tell them how to do the hand washing, you know. Also, if they like social distancing is very, very difficult in case of children. So what you can do is you can ask them the virtual play date with their playmates. Okay, so that way the coming together can be avoided in the children. But then still you can make the play in such a way that there can be the social distancing thing maintained. So the support by the parents is very, very important. Children, they may get bored, they may get like with especially with this lockdown, many children are also suffering from the mental health issue, and we sometimes we don't really think that children have these issues, but there are issues.
Yes,
how
they
y-
do.
how you can how you can find it out? Sometimes some children who are very expressive become withdrawn, they don't talk.
Mhm.
Okay. Some children just become very irritable or very cranky. They just keep on crying. Some become
Mhm.
very adamant. They become disobedient, and they want to
Mhm.
do exactly what you are opposite what you are telling to them. Okay.
Mhm.
Some children, they are just so emotionally overwhelmed. They don't want to talk, but you need to give them the assurance that they are safe. Okay, they are safe, and they can be protected by following this protective measure. Don't ever give them the false assurance like, oh, your dad is there and nothing will happen to you. This kind of assurance is kind of a over giving false hopes. Like
False
if something
assurance.
happens by by chance, if something negative happens, they will lose the trust. They will think that even you are also not able to protect them. And when you say that, when we are there and nothing will happen to you, they lose the trust in themselves. So
Mhm.
empower them by giving the responsibility of their safety also. Okay. So also when children are at home, you can distract them by giving them some things to do. You tell them, give them the time limit. In the next 1 hour, you are doing this. Okay. And then you go, you do your thing. And you come back and you just get the feedback, what is happening. So in that way, they also feel the sense of responsibility. What you can tell them? You can tell them to just clean their own room. Okay.
Mhm.
You can help them. Just keep normal routine. Let them know that they can also talk to you. Don't be very hard on them. Be
Mhm.
like a friends to them, so that they can come and they can open their feelings to you, and let them know that it's okay to express their feelings. Sometimes you can
Mhm.
also tell them how you are feeling, so that they get the confidence that how they can also tell you how they are feeling. Sometimes it is very, very difficult in case of a little bit grown up children, adolescents. As soon as the lockdown is over, they want to go out, mix up with the friends, make parties, So you can talk to them and don't tell them like in a authoritative manner. Be a friend to them. Ask them, see, you are going, and what are your plans there? And would there be like involvement of alcohol or something? What do you think about it? Would you be able to keep the social distancing after you go there? So, like when you ask them their opinion, when you make them feel that you are talking to them as their friend, they are definitely going to take their own responsibility. So that's the way you have to be with your adolescents. It's very we know it's emotionally overwhelming for the parents when their children are going out, but you have to keep trust in them as well. So that's with the children. I think that's the thing. And with the newborn, actually, we don't have the enough data about how it is how many children, newborns are affected and all. But if the mother is a corona positive, there are chances that there is a vertical transmission and also with the contact. So it's always advisable that the mother should keep herself always very the hygiene part should be taken care of very thoroughly. She should wash her hands always before and after handling her infant. When she wants to breastfeed, she can breastfeed, no problem. But then she has to clean the breast every time, and also she has to wear the new set of clothes every time she has to feed the baby, or she can express the milk and another family member who is not affected, they can take care of the baby. So the breast milk can still be given to the baby. So these are some of the important things about the newborn. If anyone has any question, you can still ask me.
So this was very important, and I guess it was very informative because many of the mothers especially had asked me this point regarding how can you protect the children, because mothers especially, they are always concerned about their kids and how they can avoid this, or at least how they can convey this message to their children. So I guess this point was so important. And yeah, so and one more thing I would like to add is sometimes, like 2 3 days back, when I had gone to the market, I had seen a very crowded place where they sell vegetables, and there were women who were carrying their children with them. They were wearing masks, but then when they try to cover the child actually refuses. Children are usually like that. They don't like to wear caps. They don't like to get covered usually. They just want to be free. So in that case, please avoid taking your children out. If the child is not leaving you, he's like, no, mama, I'll come with you. Please send someone else from your family, maybe his dad or someone else, aunt or someone, or maybe when he is asleep, you can leave him with the grandparents or someone, and then you can go out, buy your vegetables and everything. But please avoid taking your children to such crowded places, and that's how you can keep them safe. Because in India, like, we have days. Okay, Tuesday is the market day, and all the women, they'll be rushing to get their groceries and vegetables. So it's very understandable that children do not follow rules. They are kids, they won't even follow rules. So it's basically up to us. Just keep them at home, or when they are asleep, leave them with his father or grandparents, someone who can take care of them just for that short period of time, and then you can go out and do your stuff. So that was something very informative.
Yeah, that's very
So,
important point you raised. Yeah, that's very good.
We will come to our question and answer session. A couple of you have asked me, mostly the questions were regarding nutrition, and Mom, you have explained it very well regarding what foods are to be taken and what is to be avoided, and sticking to the local foods, especially our ancient herbs and everything, which helps us in the immunity build-up, and also the role of vitamin C when it comes to giving a boost in the immune system. So one of my friend from my hometown, Pune, she has asked me a very good question, which I would like to share with you. She asked me that, Joe, I'm pregnant and really wish to eat healthy and live a healthy lifestyle, especially since it's my first pregnancy. But I'm really scared to consume foods, even fruits for that matter, from outside, or even have a walk in our community garden. Please, can you suggest me something which I can do at home?
Okay. So the food actually, when you bring the grocery, the plastic should be first washed, and then you remove the vegetables. You can wash the vegetable with warm water and salt. Okay, that will kill most of the organisms. Okay, and when you cook the food, then they will be again killed. The fruits also you can wash with the warm water and salt. So, or you can use the soda bicarbonate. Okay, the soda which we use in the cooking. So that will also kill the organisms. So it can make it, you can make it safe and eat it. If you don't want to go out, if you have a terrace or if you have a garden, like some yard in your house, you can just walk in that space. No problem. You know, if you don't want to go in the park, if you are like feeling scared, so you can take a walk around your house.
Mm. Just walks on terrace will help to relax your pelvic muscles, and also doing some light exercises, which you can easily find out from the internet, or even your obstetric and gynecologist. Even she can help you with what exercises are to be done just for your pelvic relaxation, for everyone who wants a normal delivery. And yeah, that is so all whoever like are pregnant, or if you know who's pregnant at your home, please give them assurance not to panic. This is a pandemic which the whole world is facing. We need to fight it together, and panic and anxiety is not an answer to this. So please do some deep breathing exercises, talk and socialize with your family which are at home, do some light exercises, eat good food, and most important is make your mind stable, make your mind rejuvenate yourself every day, listen to some nice light music. These all things have effect on the baby. So if you stress out, the baby also gets stressed out. There's a great bond between the mother and the child. So please do not panic. This is what I would like to say to everyone who's pregnant. Just keep yourself cool. So going to our next question, Mom. This
Mhm.
was asked by two or three of my friends, and they have asked me steps to be followed when we are in travel after the lockdown, like after now the flight services and the train services are begun. So what they have to travel maybe for the work purpose, or maybe they are going back home, something, some reason. So what should they follow, like when they are traveling, to avoid anything bad?
Okay, first of all, never forget your sanitizer. Keep your sanitizer always with you. Okay, take a mask whenever you are going out. Put a mask on your face so that you can avoid the transmission. Whenever you have to touch any surface, you can, after that you can wash your hands. Okay, and always keep the distance of 6 feet between two people. no matter whatever, you just try to keep the social distancing. I know after this lockdown and after the everything started, it won't be the normal life, normal how it used to be before the pandemic.
Yeah.
So the new normals you have to follow. The new norms is always keep the distance, always protect yourself while you are going out. At least for next 24 months, you have to do this. So, and also like if you are going in a crowded place, so try to avoid those going to those crowded places. One thing I want to tell here that when you go to the malls, when the malls are opening, try and not to go in the malls immediately after opening. Okay, because all the central ACs and all were closed, and now there are a lot of molds they have developed in the ducts. Okay, so nobody is thinking about those ducts. Once the AC starts, the mold particles will be all over in the atmosphere there. So even if you
It's
are
very
putting mask, yeah, so it is very highly likely that you can inhale those mold particles. And the scientists, they are contemplating that there will be another wave of pneumonia because of these kind of inhalation of these mold particles. And also try not to go to the malls when they open. Yeah, let few days go like that.
another question which was asked was which mask is most effective when it comes to having a barrier from the coronavirus? Which mask is much better?
Okay. Look, coronavirus is not a very fine particle. It's rather a big virus. So just a double layer cotton mask is also sufficient. No, you don't need the N95. N95 is required only to the people who are dealing with the oral part of the patient. That means it is required by the anesthetists, the doctors who are putting the tubes inside the patient, or the
The
doctors dealing,
frontline workers
yeah,
in
the
the medical
frontline
system.
workers. Exactly.
True.
So don't worry if you don't get the N95 mask. It's not at all necessary. Just a double layered cotton mask is also sufficient for the protection.
Okay. And mom, what about the washing? Like, how frequently should you wash? How frequently should you dry these masks? And are they reusable for the latter use?
Okay, yes, the cotton masks are reusable. So what you have to do is you need to have at least four masks. Okay, so one mask when you are using the whole day, after coming, you should wash it and you have to dry it properly. So the next day you have to use another mask. And whenever you are using that mask, you can iron that mask. Okay, so that also whatever amount of particles there, they can be killed. But with
Due to the
your
heat,
soap,
yes.
water, and all, already the virus will be killed. So don't worry about it. So
Okay.
at least four masks you need for the like weekly use.
So the next question was, which people are most susceptible to this corona virus, and why is it so? Like, which age group or which people maybe got disease like that?
Okay, so the virus can be transmitted to anyone. The only question is who will develop the COVID-19 disease. So you, me, anyone can have the virus. We can be asymptomatic people. We can be the asymptomatic carriers. But the people who have the most risk of developing the COVID-19 disease is people who are aged, over 60 years of age. Those who have chronic comorbidities like diabetes, kidney failure, cancer, all those kind of chronic diseases, those people, they are already immunocompromised, and in that
Immunocompromised.
there is a high risk of developing COVID-19 disease and complications. there is no such thing as this kind of like ethnicity and all. It's a just observation that like African black people and some of the Asian people, they say they are more prone, but it's not really prone. It is also spread very quickly in the European countries. Why? Because initially people, those countries, they neglected, like they didn't take it seriously, first of all. Another thing, the climate, when it came there, it was very cold. And this virus replicates very fast in cool climate. And that's why it spread like a wildfire in those countries. So the cool climate, not taking note of the seriousness of the transmission, these are the factors responsible for the spread in those European countries. Even in India now, places very crowded like Bombay, especially the slums and all, it's spreading very like a wildfire there. So mainly the crowdedness, small place, is more like conducive to its transmission.
So yeah, this was one of the questions I had received. Is disease resistance strength strong for Indian people than foreign people? And I think, as you have said, like the reason why it spread so high over there was because there was not the lockdown was not initiated immediately, and also the cold climate, which is a contributing factor in these countries. And it is very true that the overcrowded places of Mumbai, even Delhi, since there are a lot of migrant workers, there's a lot of incoming and outgoing because of the jobs which they do over there. So that's the reason it's spreading a lot over there, and it's really difficult to even control. Even if the government starts the curfew or something, it's difficult to control these people because some of them are just migrant workers who don't even have a proper home in these states. So they were going to the native state, and just after the event they came to know that it's spreading over there. So it's difficult because we are a highly populated country, but yeah, the resistance doesn't matter. I mean, it's the same for us or
One
for
more
any other
thing
foreign
I
country.
want to tell here, one more thing I want to tell here, the amount of testing. We cannot test so many billion of our population, you know. So
Very true.
the testing was done in a vast like proportion in countries, the developed countries like European countries, and also in Australia. They are testing every day. They are testing more than 1 lakh people in just Victoria. So that's why they could detect more and more numbers, you know. So sometimes that also mattered in our case in India because we couldn't test many people there. Yeah.
Mom, how is the COVID-19 situation there in Australia? Like, what is the rate affected, deceased, recovered? Any statistics about it?
Yes, actually the curve is already flattening. It's no new cases in Victoria now. Very few, maybe 8 or 10 at the most. And it was the problem was more in the New South Wales and Sydney area. But we are very safe this side. We don't have much problem here.
Okay. Mom, another question which I got, and I feel it is very important that we discuss this. One of my friends have asked me, like one of their family member tested positive for COVID-19, and now the whole family is put into quarantine. And they were tested negative initially, but once they get discharged, like what are the preventive measures they should take from this patient or the family member who was tested or positive for COVID-19, what should they do, and how long should they implement these safety measures?
Okay. So, like if that positive person, if that person is with symptoms, then they have to, anyway, when the person is positive, they have to isolate that patient. Make, if it is not possible to be in the quarantine region, in the house itself, if they have a room for that person with a attached facility, then that person can be kept there, and all the other members, they should keep the social distance with that person, uh, and whenever that person, if it is not possible to have the separate toilet and facility, then whenever that person is using those facilities, those areas should be disinfected. So that should be done, and that person should use the mask. And also, whenever somebody is coming in contact with that, doing something, they should also have the mask. Again, hand washing, hand washing, hand washing. That's the best policy that is to be followed. Whenever you are
That's
doing
the best and
anything,
the
yeah,
baseline
that is the best
rule.
strategy. And first of all, the positive person should not get panic, because not all positive people are turning into COVID-19. Okay, there are high chance that they will be recovered. So, not to panic, take good care of yourself, good hygiene, good food, good exercise also. Body and mind both. They should do yoga, they should do meditation, as I told earlier, the mindfulness exercises. They should do some walking inside their room, or they should do some kind of exercises in their room. So that can be done. And all the other family members who were quarantined and negative, they should still follow the routine measures of prevention, like hand washing again, and
Yeah.
whenever within the family also keep social distancing.
Mm. Because there are fomites present, like fomites are the pathogens which are present on the object. Like suppose if we touch the mobile, even if the COVID positive person, even they touch the mobile, or for example any doorknob or something, so the family members please need to have a hand sanitizer. Like even if they touch the doorknob or they give the food and they come back, they need to again sanitize the hand, or at least wash the hand, which is very important, because the presence of fomites will be there even in the isolated room. So even if the person is isolated, still we need to give food and water and provide the
Yes.
basic things to that person. So uh,
Mhm.
the baseline thing is, okay, we can just have a hand sanitizer, or after we give food or have some contact with that person, to come back, have a change of clothes, and especially sanitize your hand. That's the most important thing, and not touch face or
Yeah,
nose or mouth without proper hand sanitizer.
hand washing. Yeah.
Hand washing, yes. So I think that is all. Thank you everyone for
Okay.
joining us. Mom, thank you so much for all the information that you have given us. I'm sure many have benefited from this. And basic thing which I would like to end this session with is, do not panic no matter what happens. This is a pandemic and the whole world is suffering with it, and we need to fight it together. So basic thing is social distancing. Like we all are in lockdown right now. Even when we go out to buy the daily needs, vegetables, everything, please protect yourself. Always carry a hand sanitizer whenever you go, because when you go outside, you cannot wash your hands. So when you touch something, even money for that case, when someone gives you money, when you or when you give someone money, avoid the fomites by using a good sanitizer. Always carry a sanitizer whenever you go out, and avoid taking your children outside. It's better they stay at home. They stay safe with the family members when you go outside for purchasing. And if uh, any depression or any sign of feeling of loneliness because no job and the payment is not done, always express yourself. Do not feel low, because I'm sure what you are expressing, what you are feeling, even many people are there within the friends group, even they feel the same. So it's better to express ourselves, keep in contact with our family members. They are the closest friends we can have at this point. So we'd like to end this session by saying that stay home, stay safe, and always call for help. There is nothing to feel low about, because this will end soon, and this will. We just have to fight it together right now, and we all will be back to our normal lives after a while at least. So yeah, thank you so much. Mom, would you like to say something?
Yeah, thank you, Joe. Thank you, Praveen. Thank you, Naveen, for this initiative. And thank you for giving me the opportunity to share some of the things. And thank you, viewers, for joining us. Just I would like to end with the words of some unknown poet. It's वक्त ही तो है गुजर जाएगा. It's not anything else. It's just a time. It will pass. Okay. So we have to be positive, and we should be united together. We should keep in touch with each other, talk to each other, stay connected, stay safe. Okay. Thanks again. Yeah.
Okay, Mom. Thank you so much.